When taking the OM3-DHA-EPA-B12-Fa-B6-Phytost Capsule, it's important to follow your doctor's instructions. You can take it with or without food, usually once daily. If you experience any stomach upset, taking it with food may help. It's important to use this medication regularly to receive the most benefit from it. Try to take it at the same time each day to help you remember. The dosage will be determined based on your medical condition and how you respond to the treatment. Some common side effects of taking OM3-DHA-EPA-B12-Fa-B6-Phytost Capsule may include nausea, stomach upset, diarrhea, or flushing. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as easy bruising or bleeding. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, be sure to contact your doctor or pharmacist for further guidance. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting to take OM3-DHA-EPA-B12-Fa-B6-Phytost Capsule, it is important to inform your doctor or pharmacist if you have any allergies to its ingredients, fish, or soy products. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's essential to discuss this with your pharmacist for more information. Additionally, it's crucial to inform your doctor or pharmacist about your medical history, especially if you have certain blood disorders, such as pernicious anemia or other anemias. If you are pregnant, it is important to use this medication only when it is clearly needed. It's important to have a discussion with your doctor about the risks and benefits. For those who are breastfeeding, it's important to consult with your doctor before taking this medication, as it can pass into breast milk. It's important to be aware of potential drug interactions when taking OM3-DHA-EPA-B12-Fa-B6-Phytost Capsule. This means that it could change how your other medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with this medication include certain anti-cancer drugs, certain anti-seizure drugs, chloramphenicol, levodopa, methotrexate, pyrimethamine, and other vitamin/nutritional supplements. Additionally, this product may interfere with certain lab tests, possibly causing false results. Be sure to inform the lab personnel and all your doctors that you are taking this product. As always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. Your doctor may also run lab or medical tests while you're taking this medication, such as a complete blood count or checking your vitamin B12 levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Remember, it's always best to get your vitamins and minerals from healthy foods. Try to maintain a well-balanced diet and follow any dietary guidelines given by your doctor. B vitamins, including folic acid, can be found naturally in leafy greens, other vegetables, and citrus fruits. Folic acid is also found in enriched grains such as bread, pasta, and cereal. As always, consult your doctor for the best advice on your nutritional needs. If you forget to take a dose of this medication, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store OM3-DHA-EPA-B12-Fa-B6-Phytost capsule at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless you are instructed to do so. When it is expired or no longer needed, be sure to properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.